Public Health England is an executive agency of the Department of Health and Social Care in the United Kingdom, which began operating on 1 April 2013 to protect and improve health and well-being and reduce health inequalities. Its formation came as a result of the reorganisation of the National Health Service in England, outlined in the Health and Social Care Act 2012. It took on the role of the Health Protection Agency, the National Treatment Agency for Substance Misuse, and a number of other health bodies. It was an executive agency of the Department of Health and Social Care, and a distinct delivery organisation with operational autonomy. On 1 April 2021, Public Health England was replaced by the UK Health Security Agency, a new body created to deal with the threat of infectious diseases by combining FE with the NHS test and trace operation. FE will continue to have a transitional existence until 1 October 2021. At the same time, the Office for Health Promotion was established. Proposals for reorganizing the National Health Service were published in the early months of the Cameron-Clegg coalition. In a July 2010 white paper from the Department of Health titled, Equity and Excellence, Liberating the NHS, this was followed by a more detailed paper, Healthy Lives, Healthy People, Our Strategy for Public Health in England, in November. The bill to implement the proposals was introduced to the House of Commons in January 2011, and was the subject of a report by the Health Select Committee in October. Responding to criticism, the government published Healthy Lives, Healthy People, Update and Way Forward in July. The Health and Social Care Act gained royal assent in March 2012, with all elements of the new system to be operative by April 2013. The Act established Public Health England as an executive body accountable to the Secretary of State for Health. It took over public health activity from the department and from the regional strategic health authorities, and all activities of the Health Protection Agency, the National Treatment Agency for Substance Misuse, the Public Health Observatories, the Cancer Registries, the National Cancer Intelligence Network, and the UK National Screening Committee together with its screening programs. Each year the Department of Health and Social Care sets out PHE's remit and priorities in a letter to the Chief Executive. PHE's mission is to protect and improve the nation's health and to address inequalities. It employs approximately 5,000 staff, who are mostly scientists, researchers and public health professionals. It announced plans to move its headquarters and 2,750 staff to Harlow on a former GlaxoSmithKline site in 2017. FE laboratories provide an extensive range of microbiological diagnostic tests. The Secretary of State sets the total budget for public health and determines how it is allocated between FE and local authorities. The 2012 Act, which established FE as a national body, also returned to local authorities the responsibility for a range of community and public health services. Each upper-tier local authority is required to appoint a Director of Public Health, an officer of the authority who is responsible for the authority's public health functions, including responding to emergencies. As of 2020, there are 134 of these posts. A reorganization of public health protection in England was announced by the Secretary of State for Health and Social Care, Matt Hancock, in August 2020. FE would be combined with NHS Test and Trace to form a National Institute for Health Protection, under a new leadership structure headed by Conservative peer Dido Harding as interim CEO. Michael Brodie, current CEO of the NHS Business Services Authority, was appointed as interim FE CEO, replacing Duncan Selby. In March 2021, it was announced that the new agency would instead be the UK Health Security Agency, commencing on 1 April and led by Jenny Harries. The new UKHSA would focus on infectious disease control, particularly the ongoing COVID-19 pandemic. Options for PHE's other roles, such as preventing ill health and reducing health inequalities, were to be discussed, with the decision made in March 2021 that these functions would move to new homes within the health system, including the creation of an Office for Health Protection within the Department for Health and Social Care. While it was originally announced that FEE would be wound up on the 31st of March 2021, the body will continue to have a shadow existence until the 1st of October 2021. To support the transition and temporarily continue the non-UK HSA roles, the FEE name and employment contracts will remain until the 1st of October. FEE has the following public-facing divisions. Duncan Selby was the chief executive of FEE from its formation until 2020. He was previously chief executive of Brighton and Sussex University Hospitals NHS Trust in The. Reorganisation announced in August 2020. Michael Brodie was appointed as interim CEO. Brodie was